Again, usually I do this on the floor because it's easier, but you can definitely do this on the table. It might be harder to do both legs at the same time, okay? But what I do is you have to kind of spread the legs out at about 30 degrees or so. His legs are still kind of in that position from before, so what I do is I just press both feet into the buttocks this way. The reason it's easier to do on the floor, or if you get on the table, it's easy because you're centered over the patient instead of having to reach over to get this leg down. But you just press both feet in towards the buttocks. Okay, and then what I do is I fold one over the other, and then again same thing. And then opposite side. So and this is again, it's just a stretch for the knee. Yeah. Okay, and then let's see. After that, we transition to working on the gallbladder channel and the side of the leg, the hip and the side of the leg here. So what we do is we try to put the leg in a number 4 position. So I'm working on this leg first. So we keep this leg straight, yeah, and then we bend this knee. I kind of have to turn this leg out and at a slightly greater angle, and then we let the leg fall this way. Some people, they have a lot of restriction in their hips, so they won't. When you do this, their leg will float or something, So sometimes you have to move the angle in, or what I do sometimes, if you have a pillow, it's good to prop it up here, just so they have something to rest against. Because I'm on the floor a lot, sometimes I'll just put my knee here so that it kind of rests. But you don't want them to have their leg hanging. The other thing is if their hip is really immobile, then I would just kind of work on the side of the leg in a more neutral position, just so that you take off the strain of that. Okay, but the advantage of putting the leg in this position is it really opens up this side of the leg for you, okay, which is more the gallbladder. You can start off more again with rubbing along the gallbladder channel. Okay, but usually I just go right into pressing with the palm. So we start off on the hip and buttock area, gallbladder 30 area, putting palm pressure, and then just kind of walk the palms down along the outside of the thigh. This is along the gallbladder channel, gallbladder 31. I don't usually put pressure here because, one thing, if their hips are already tight and it's hard to, you don't want to be forcing the hip to do anything. Okay. After I do the palm pressure, I usually go right into working on the hip and buttock area, because this has a lot of tissue. You can use it's probably best or easiest to use your elbow, but you really have to be careful about not causing any problem. Okay, so just be aware of the level of penetration you're using, and try to sense whether it's too much for the patient or not. So there are a lot of this can be a large area, and there are a lot of ways to cover that area with, your elbow. When I first learned shiatsu, they taught us to go in a kind of a spiraling line. So we start off kind of from the center of the buttock around gallbladder 30. We just kind of spiraled outward. But the main thing is that you do a sufficient job working in this area. Sometimes if you want to, you can try to sense or try to palpate for particular areas of pressure. Although the difficult thing is, because it's deep. You know, sometimes you can't feel it necessarily from the surface. Okay. But yeah, I use my elbow exclusively for this area. And then, okay, from there you want to work down the gallbladder line. So gallbladder line, it's kind of the same thing as the UB, urinary bladder line. If you take the front and the back of the thigh, the gallbladder line runs down the lateral midline of the thigh. So kind of on the, if you're looking at the seam line of a pants, it's usually the gallbladder kind of runs straight along that seam. Okay. There is a there is like this tendinous. It's pretty much all connective tissue, but it's called the tensor fascia lata. If you look at some anatomy drawings, you can see it. It's like a white band of tendon that just runs along the lateral side of the thigh here. And a lot of people, it's really tight. And you know, usually if you apply pressure and you walk down, especially as you get closer to the knee, like especially as you get to about like gallbladder 31 or so, a lot of people feel a lot of tenderness at that area. So just be aware of that. This tensor fascia lata is kind of implicated in a lot of knee problems.
How do you say all that?
I'll write it down. But,
Sounds like
tensor,
a drink.
Yeah, latte.
I know, I put latte.
Yeah.
Attention, here comes a latte.
You can do some more of the grasping, okay, even for this area as well, but primarily for the lateral thigh. But you'll notice like this area is tends to be a lot harder, especially as you try to grab around to the front of the thigh. So it's a lot harder to pick up distinct sections of the tissue. Sometimes what I do is, especially if the leg is exposed, I'll actually push down the length of the tensor fascia lata. Okay, you can use like your knuckle, your fist this way, and push down. What I like to do is use the forearm. Okay, but a few tricky things about this are that you have to get across the table, and you're pushing down, so it's easy to kind of lose traction or control. Okay. And this leg is kind of not. I'm just going to rest your leg here, okay? So, yeah. So you can kind of use my forearm. I'm not going to actually be pushing because I'm working through cloth here. But, just using your forearm more like a bulldozer or grater. You're just working down the length of the...
On the ground, he hook his foot over your ankle.
Yeah. But just progressively working down this way. But again, you have to kind of go across the table. So sometimes it's, especially if you're shorter, it can be hard to do that.